Well, Dave and Glenda, we all want to slow the spread of COVID-19, but especially our elected officials. However, after the Michigan Supreme Court stripped Governor Gretchen Whitmer of her powers, the question then turned to what's next? What is our legislature going to do?
It's important that we continue to have a path that would bring clarity and certainty as we move into the next stages.
State Representative Ben Frederick is behind the Republican plan to manage COVID-19 restrictions in Michigan in what he calls a mid to long-term plan.
So this would allow there to be a path for counties based on their local data to be able to modify some of the DHS orders that are currently in place.
State Republican lawmakers fought with Governor Whitmer over her emergency powers since April. The Michigan Supreme Court ruled on October 2nd that the governor didn't have authority to continue declaring states of emergency and issue unilateral orders past April 30th, calling it unconstitutional. The Supreme Court then ruled on October 12th that Whitmer's emergency powers must be stripped immediately.
With the governor's ongoing response, with the lack of clarity on benchmarks, what happens next, why.
The plan would use scientific data for health officials in each county to issue specific restrictions based on levels of COVID-19, testing capacity, and hospitals' ability to treat patients.
I don't really consider it much of a plan. It's more of a kind of kick in the can to local municipalities.
Democrats say the Republicans' plan needs more clarity, and there's a lot more to work out.
Simply having a county-specific plan that would allow local county officials to make decisions would not ensure provisions for PPE, hospital capacity. It's really not a plan. So there's a lot of holes in it.
One thing both Democrats and Republicans can agree on, they need to come together to get this virus under control.
Let's be, really sensible here. Let's make sure that we're working together and compromise for the good of all Michigan citizens.
We have had some feedback from healthcare and public health on ways we can make the policy better. And we certainly do want it to be a bipartisan approach throughout.
All right, and right now that Republican plan is going through the Health Policy Committee. If it does get through that committee, it will then go through the legislative process. Reporting live tonight, I'm Alan Campbell, 7 Action News.